This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Apixagress 2.5 tablet is an anticoagulant that helps in managing blood clots. It is commonly prescribed for various conditions related to blood clot formation. Indications and uses. This medication is indicated for the management of blood clots formed in the veins of the legs, particularly after hip or knee replacement surgeries. It is also used to prevent blood clots in patients with irregular heartbeats, such as atrial fibrillation, and to manage the recurrence of deep vein thrombosis and pulmonary embolism. How it works. Apixagress 2.5 tablet works by inhibiting factor XA, a crucial component in the blood clotting process, thereby preventing the formation of clots. Directions for use. Take Apixagress 2.5 tablet as directed by your healthcare provider. It is recommended to swallow the tablet with a glass of water. If you encounter difficulties swallowing, consult your doctor for alternative administration methods. Your physician will determine the appropriate dosage based on your individual health status, age, and weight. Possible side effects. Common side effects may include bleeding from various areas such as the eyes, nose, and gums, along with symptoms like bruising, anemia, and low blood pressure. It is essential to monitor these effects and inform your doctor if they occur. Precautions and warnings. It is crucial to take this medication with caution, particularly in patients with liver or kidney diseases, as well as in elderly individuals over 75. Pregnant and breastfeeding women should seek medical advice before using this medication, and those with a history of bleeding disorders should inform their doctors to avoid potential complications. FAQs. 1. Is Apixagress 2.5 tablet a blood thinner? Yes, it is an anticoagulant that helps manage blood clot formation. 2. What precautions should I take while using this medication? Inform your doctor about any existing liver, heart, or kidney conditions. 3. What if I forget to take a dose? Take it as soon as you remember, but do not double up. 4. Can this medication cause low blood pressure? Yes, it can and may lead to a faster heartbeat. Consult your doctor if this occurs. 5. Is it safe during pregnancy? It is not recommended due to unknown effects on the unborn child. Thank you for watching. We hope this information was helpful. If you have any questions or suggestions, please feel free to leave a comment below.